Welcome to The Throat and Nothing But the Throat. I'm Christine Jacob-Sandejas. And for today, let us now talk about this controversial phenomenon called throat anxiety. What is it? I mean, is it actually normal to be worried about a seemingly minor sore throat? And that being said, what should we do about it? Well, good thing we have our guest doctor here to answer once again all of our questions, Dr. Joseph Cedeno, and he is the chairman of the Department of ENT-Head and Neck Surgery at Makati Medical Center. Hi, Doc. Welcome back.
Hi, Christine. Nice to see you again.
Oh, wonderful seeing you again,
yeah,
Doc. Okay.
Yeah.
Eto na. Let's tackle this thing about throat anxiety. I mean, is there really such a thing as throat anxiety? What is it?
Yeah, there is. Technically, throat anxiety is just a term coined to mean an anxious feeling that you experience when you experience discomfort in your throat. Marami sa atin ang medyo nagkaroon ng pagdududa, pangamba, kung ano nung iniisip possible sakit kapag nakakaramdam na nito. May mga iba nga iniisip maka-cancer na ito. But most of the time, di ba, as I've said before, na possibly virus lang yan. Pwedeng may mga ibang iniisip na baka nakahawa na nga ng virus or baka nagkaroon ng bacterial infection. And pwede din itong lumala. So yun yung mga naisip ng may mga tao. That's why nagkakaroon sila ng throat anxiety.
Okay, so when you say, let's dissect it just a little bit more, Doc, before we move on to our questions. So pag sinasabing throat anxiety, I really feel something, di ba? I really feel that there's a sore throat, there's something going on. But am I exaggerating? Am I just overly concerned?
Well, when doctors take a look at patients, we don't downplay what they complain. When they're complaining, we have to adjust this complaint no matter what it is. Dapat hindi namin binabaliwala kasi it can be really something serious na hindi naman natin alam. But commonly, ang throat infection, madaling agapan, madaling i-treat ito. Many times, lalo na kapag viral infection, pwede itong lumala and symptoms can become severe. Pwede pa magkaroon ng fever, and it can subside in 1, 2, or even 3 days. Hindi natin maiwasan magamba pag matakot sa mga ganitong nararamdaman. That's why pumapasok yan ng throat anxiety, kung saan nagkakaroon ka ng doubt and fear when it comes to real problems behind your sore throat. Kasi you don't know, maka-virus nga, maka-allergy lang naman pala, baka bacteria, mamaya iba pala, baka may tumutubo na dyan na bukol or anything like that. So it's really important for us to address yung mga nararamdaman na symptoms na ito. That's why we also need to practice proper oral hygiene, not just weekly. We can do it in a daily basis using products that are proven effective against the signs and symptoms of sore throat.
So Doc, what you're saying actually is that it is normal. It is normal for us to actually be a bit worried about even, something such a minor sore throat, only because I think we have to be mindful of what actually happens to our body. Because as you said nga, it can be treated, di ba? Kung maagapan, if we respond to it properly, if we know if it's a viral infection or a bacterial infection.
Yeah. It's a normal thing that we get throat anxiety. That's why we have to have it checked. Yun na nga, commonly pwede talaga siyang matreat. Madali lang talagang i-treat. Nag-worry lang tayo masyado. And maganda yon. Mas pabor pa nga sa doktor na dumadating ang pasyente early para malaman ka agad and ma-address ka agad yung first symptoms.
Yeah.
But besides this, you can already start with certain medications to soothe your throat. Initially pa lang, pag nag-start, lalo na, mahirap minsan get an appointment with a doctor. So you can start this right away.
I mean, exactly, you hit the nail. I mean, because nowadays, with all of this technology, at our fingertips, we all become our own doctors, and then I'm sure most of us are actually curious, like, when should we be worried about a sore throat? And then if ever we do find that there is an onset, sabi mo nga, that what can we do about it?
Well, at first you can use medicated lozenges, throat sprays, or antiseptic gargles, yung specifically formulated to fight sore throat viruses.
Okay.
Now, if your sore throat is severe and hindi pa kumagaling matapos ng ilang araw na, 1 to 2 days na, 3 days na, may nararamdaman ka pa, tapos yun, you already have fever and you have those makulani or lymph nodes na getting swollen, that's the best time you can contact your doctor. Ito yung mga symptoms na ito ay possible signals already of a bacterial infection such as your strep throat, and the management is already different.
Okay. So there's certain medicines or things that work depending on what the cause of our sore throat really is, diba? And of course, we're talking about throat anxiety, but of course, we don't want to cause any more anxiety than necessary. But of course, this is, I think, knowledge is true power, diba? So Doc, I have to ask you, ano nga ba ang mga complications na pwede mangyari if ever mapabayaan ang ating sore throat? What's the worst thing that can actually happen, Doc?
Yeah, but this is not to scare anyone. Para lang we know what can possibly
We know what we're up
happen.
against,
That's why we have to treat it right away. Or when you feel something, try to use this lozenges, throat spray, or antiseptic gargle right away para malinis ka agad. Tapos kapag hindi gumagaling, magpa-check ka agad. Now, specifically sa strep throat, if hindi talaga gumagaling, worst scenario, it can cause kidney problems like your glomerulonephritis, or it can also cause rheumatic fever. Wow. These are serious illness that can cause permanent damage to your kidneys and your heart. But calm down. Strep throat can be easily diagnosed with a simple throat culture or swab na ginagawa namin just in the clinic setting. At the same time, pwede ring maggamot ka agad with a course of antibiotics ang strep throat. Hindi tulad ng viral sore throat. Ang strep throat ay bacterial, kaya posible talaga magamot with just antibiotics para maiwasan ang paglala at pwedeng mag-cause nga ng other problems or pwedeng mag-lead to severe illnesses like pneumonia or rheumatic heart disease or bronchitis. Ang antibiotics kasi ay may kakayahan na bawasan ng pananakit sa loob ng isang araw lang o we expect that these antibiotics will actually work in 3 days time. 3-4 days, dapat gumagana na yan. May mga iba, 1 day pa lang, nagsasubside na yung mga nararamdaman.
Okay, so as long as we are actually aware of what's happening, and once we know that pag viral, it will just kind of go away on its own, di ba? Pero pag medyo after a few days at wala pa nangyayari at medyo you feel that you have a fever coming on and things are getting worse, you definitely have to go, see your doctor to have it checked, because as you said nga, meron din mga antibiotics na pwede naman agapan at para hindi naman lumala at dumating pa sa ating mga kidneys at kung ano-ano pa. So I guess, we all do agree, Doc, that throat health actually plays quite an important role when it comes to our overall health. And, I would also like to remind our viewers once again, first, take throat issues seriously and be cautious when it comes to their symptoms and their treatment. As Doc said, we do have people like Doc around to always run to if we do have any problems, which is why you're here with us today, Doc. Maraming salamat, Doc Joseph, for enlightening us once again about throat anxiety. At para sa ating mga viewers, if you do have any questions, please feel free to share them on the comment sections. And of course, we will always try our best to answer them all. And thank you, everyone. This has been The Throat and Nothing But the Throat.